Across Africa, millions of women go about their daily lives, working, raising families, and supporting their communities. But behind this everyday routine, many are quietly fighting a battle they rarely speak about. Sexually transmitted infections, or STIs, affect millions of women across the continent every year. Yet many cases remain hidden due to stigma, fear, and lack of access to proper health care. In response, many women turn to alternative treatments, herbal remedies, household substances, or antibiotics purchased without prescriptions. What begins as an attempt to find relief can sometimes lead to something far more dangerous, a growing global threat known as antibiotic resistance. And for many women, the consequences can be life-changing. Sexually transmitted infections are among the most common health conditions affecting women worldwide. In many African communities, infections such as chlamydia, gonorrhea, and syphilis continue to spread due to limited testing, stigma, and barriers to healthcare. But the challenge is not just medical, it is also social. Talking openly about sexual health can be difficult in many communities. Women may fear judgment, discrimination, or even relationship conflicts. As a result, some avoid clinics entirely. Others may delay seeking treatment until symptoms become severe. For women living in rural areas, the situation can be even more difficult. Clinics may be far away, transportation may be expensive, and healthcare systems are often overwhelmed. When formal healthcare feels out of reach, many women look for other solutions. Across markets and neighborhoods, informal health remedies are widely available. Traditional herbal medicine has been used for generations in many African cultures and remains an important part of community healthcare. But when it comes to treating infections like STIs, not all remedies are safe or effective. Some women rely on herbal mixtures sold in local markets. Others follow advice shared through friends, family members, or social media. Without medical guidance, these treatments may not address the actual infection, and in some cases, the infection continues to spread silently within the body. While traditional medicine can play an important role in healthcare, the lack of proper diagnosis and testing can make STI treatment especially risky. In some cases, the search for quick solutions leads to dangerous practices. Reports from public health studies have documented the use of substances never intended for internal treatment. Some women use antiseptics, strong soaps, or acidic solutions in an attempt to cleanse or treat infections. These substances can disrupt the natural balance of bacteria in the body. Instead of curing the infection, they may worsen irritation, damage protective tissues, and increase vulnerability to further infections. Without proper information, these practices can unintentionally create more serious health problems. Antibiotics are one of the most powerful tools in modern medicine. They have saved millions of lives by treating bacterial infections that were once deadly. But antibiotics must be used carefully. In many areas, antibiotics can be purchased easily from informal drug sellers or pharmacies without prescriptions. Instead of receiving a full medical diagnosis, patients simply describe their symptoms and receive a few tablets. Sometimes the dosage is incomplete. Sometimes the wrong antibiotic is given, and sometimes treatment stops as soon as symptoms begin to disappear. While the infection may seem to improve temporarily, the bacteria may not be fully eliminated, and this is where a much larger problem begins to develop. Bacteria are remarkably adaptable. When antibiotics are used incorrectly or inconsistently, some bacteria survive. These surviving bacteria develop ways to resist the effects of the medicine. Over time, they multiply and spread. This process is known as antibiotic resistance. Infections that were once easily treated may become more difficult or even impossible to cure. According to global health experts, antibiotic resistance is one of the greatest medical threats of the 21st century, and sexually transmitted infections are increasingly becoming part of that concern. Some strains of gonorrhea, for example, have already developed resistance to multiple antibiotics around the world. For many women, untreated or resistant infections can have lasting consequences. Chronic pelvic infections may develop, fertility can be affected, pregnancy complications may arise, putting both mothers and babies at risk. Infections can also increase vulnerability to other diseases, including HIV. But beyond the physical effects, the emotional and social impact can also be significant. Women may experience stigma, anxiety, or relationship challenges related to reproductive health problems. And because these infections are often hidden, many suffer without support or proper treatment. The growing challenge of antibiotic resistance makes these risks even greater. Despite these challenges, solutions do exist. Public health programs across Africa are working to expand access to testing, treatment, and education. Community health workers are helping women learn about STI prevention and the importance of proper diagnosis. Healthcare systems are improving laboratory testing so infections can be treated with the correct medicines, and awareness campaigns are encouraging responsible antibiotic use. When antibiotics are used properly with the right medication, the right dose, and the full treatment course, they remain powerful life-saving tools. Education and access to care are key to protecting their effectiveness. Antibiotics transformed modern medicine. They turned once deadly infections into treatable conditions. But their future now depends on how responsibly they are used. For millions of women across Africa, better awareness, improved healthcare access, and safer treatment options could make the difference between silent suffering and lasting health. Because protecting antibiotics today means protecting the health of future generations.